Welcome to Healthcare Matters, bringing you the latest insights and innovation shaping the future of healthcare. My name is Peter Birch, and this episode is powered by Arab Health in partnership with Clemenceau Medical Center. Today we're exploring how advancements in technology, personalised medicine, and new models of care like hospital at home are shaping the future of patient care. Joining me today is Mark Adams, CEO of Clemenceau Medical Center. He's got over 35 years of experience leading hospitals, diagnostic centres, and healthcare networks across multiple regions, and under his leadership, CMC has embraced cutting-edge models of care, ensuring that quality healthcare is both innovative and sustainable. Today we're going to explore the future of hospital at home, the role of artificial intelligence in personalised care, and how healthcare leaders can navigate industry challenges while keeping the patient at the centre of it all. G'day, Mark. Welcome to the show.
Hi, Peter. Nice to be with you.
Thank you so much for joining. I would love for you to be able to set the scene a little bit for us and, knowing your little bit about your background and your experience in with healthcare, you would have seen how different models of care have changed how patients get care and this concept of personalised care. I'd love to really know firstly from you about those advancements over the years and kind of how particularly Clemenceau Medical Center has contributed to that transformation in healthcare.
Okay. Well, obviously, what you're alluding to is that I'm fairly old and I've seen things change over the decades, and you're not wrong. I think if you look at how healthcare has changed philosophically, it's kind of gone from a parent-teacher relationship where patients would turn up when they're feeling poorly and the doctors would be all in control and you'd follow their guidance rigorously. And, it was very much about, everything was relying on the doctors telling you what to do rather than a sort of shared mandate of, how do I take care of my own health? What do I do preventatively? How do I ensure that I don't make a problem worse by doing the wrong things? In the last 20, 30 years, you've obviously seen the whole area of human genomics taking the level of understanding of the composition of a human being to a whole new level. There's been amazing advancements in pharmaceuticals, different types of technology. But I think, as we're in sort of 2025, we're on the cusp of the biggest changes in healthcare that I think we've ever seen. Obviously, when you're dealing with intelligent doctors and scientists, there is an amazing ability that they've had through their education, but they're still processing everything with the capability of a human brain. When you start to get into artificial intelligence with massive reserves of power and huge amounts of analytical capability, these machines can do far more than a human being can ever do. And it's all around the kind of processing and the accumulation of data and letting these machines learn and learn constantly in a dynamic manner, and then applying it to solutions that would be beyond the capability of a human brain. Already you're seeing, just as an example, in radiology, where you've obviously got radiographers and radiologists all over the world, it's fairly normal to have an error rate of about 5% in misreading scans. This is why most major hospitals will do sampling and they'll do repeat testing to try and catch anything that was missed the first time. But you're already finding that where you're using AI to actually analyze a scan and an X-ray, you're reducing the error rate by about 40%. And that is likely to get better and better. So institutions like Johns Hopkins in America, for lots of their radiology, they will actually have the AI analyzing it first and then passing its findings to consultant radiologists to actually do any further interpretation. And this is only going to get bigger and wider as we go on.
Yeah. Well, look, you've touched on a point that I think about a bit, which is, so true that there are many tasks that algorithms or the computer is much better positioned to perform consistently at scale. It makes sense that if we could swap out the humans doing some elements and have the computers do it, then that's great. But in the end, if it doesn't improve patient outcomes, we're kind of not really addressing a real problem. But it sounds like you're saying that it's not just being more efficient, but it can actually has the potential to improve patient care.
Yeah, no, it does, and it touches at the moment on more procedural data-based elements of supporting patients. So over at Arab Health over the last couple of weeks, I saw one organization that is using virtual assistants in artificial intelligence to help a patient navigate around a system. So, conventionally, if a patient was to ring a hospital and speak to a call center operator, you'd expect a well-trained operator to be able to talk to the patient about the choice of doctors, the range of departments that you've got, maybe to give you a very high level understanding of the services that can be provided. But when you look at AI, it has the capability instantly to take 10,000 calls an hour. They can talk immediately in 80 different languages. Rather than just talk to you about a doctor, it can say to you, well, this doctor qualified in London, worked in the Mayo Clinic or John Hopkins in America for 10 years. They specialize in A, B, C, D, and E. Patient satisfaction levels is X, Y, and Z. And would you like to make an appointment? And unlike the sort of early automated calls where, press 1, press 2, press 3 for an answer, with this technology, you don't even know you're talking to a machine, and they are taught empathy, they're taught a sense of humor, and they have that vast capability for understanding things that a human being can't. And I think what you'll see is a lot of back office functions gradually moving to more and more supplementary support by AI, but also starting to move into clinical guidance and clinical support. Because if you've got the data, the AI can look for patterns and it can look for familiarity of trends and information to guide a doctor on something the doctor might not have been able to remember or pick up in their own sphere of experience.
Yeah, and this thinking about innovative technologies and new ways to do things. You mentioned that it's quite prevalent back of office, but increasingly, in front of the patient or on a clinical side. I feel like it also ties into this evolution we've seen in different models of care in healthcare too. And like you touched at the start too, of we've gone from that quite transactional parent-teacher type relationship in healthcare to one that's a bit more, I guess, collaborative or has a bit more personalized even. I'd love to unpack a little bit more this concept of hospital at home and the stuff that CMC is doing to be able to I guess, deliver care in more effective ways to patients. Can you tell me a little bit about that?
Yeah, and I guess it ties into how things used to be done, where healthcare was very much about buildings and geographical locations. So you might go and see a primary care physician in the community. If you had something diagnosed, you then might go to a secondary or a tertiary hospital for treatment. Actually, there's a lot that's very good about these established institutions, but there's also things that can be difficult for patients. So if you're dealing with chronic disease patients who are quite often going up and down in the condition of their health, or you're dealing with frail elderly people in their late 60s, 70s, 80s, might have multiple comorbidities, and again, they are frequently falling a little bit off the perch and needing to be picked up again. For them to have to go into a hospital that might not geographically be convenient, being away from their familiar surroundings, away from their loved ones, potentially in a hospital where occasionally you can have hospital-acquired infections. There's actually a lot to be said that if you can provide care to a patient in their own home, it is safer, it's more reassuring, And with the technology that's available today, you can monitor a patient in most cases almost as well in their own home as you can as if that patient was in a hospital bed. So where you have, maybe patients that are uncontrolled diabetics and you're worried about things like the use of insulin, how they're taking their medications, the dangers of a diabetic coma, to be able to have an electronic patch where you can monitor them 24/7 and be aware that they might be starting to have a problem before they do, that's immensely valuable. Similarly, you might have an elderly patient that has a big fall in blood pressure, which might have led eventually to a collapse and a broken hip or a broken arm. To be able to spot that the blood pressure has changed, or blood oxygen levels or anything that you are able to measure routinely, you can have doctors and nurses supported by AI monitoring these patients, spotting any outlier that's unusual, and then intervening maybe initially by phone, and then if necessary sending a nurse or a doctor to the patient's house. And if you can actually stabilize the patient and stop them being readmitted into the hospital, it's good for the patient, it's good for their family, and ultimately it adds cost efficiency to the system.
Yeah, that all resonates with me, and I can see all those benefits in terms of, and I could see that working really well in a controlled environment with perhaps a pilot with willing participants on both sides, your early adopter clinicians and your patients that are actively engaged. But I think sometimes about, particularly in an area like healthcare where we're pretty well established in our ways and we like to do things the way they've been done because that's the way they've always been done in some parts of the world. So how scalable do you think some of these newer models of care like hospital at home are? Is it something that can go beyond a particular region that's really actively engaged in it and reach that broader audience?
Yeah, I think there are two factors. I've mentioned that from a patient point of view, having the peace of mind that you've got a team of doctors monitoring you 24/7 and knowing that you'll pick something up before the patient might even know that they were heading in a direction of a problem, that gives immense peace of mind. It gives perhaps more peace of mind to the adult children of elderly parents, that the children also know that their parents are being protected that way. But when you kind of unpack the economics, 80% of healthcare costs are driven by 20% of the patients that have these chronic conditions. And all over the world where successful hospital at home programs have been rolled out, you're typically saving somewhere between 30 and 40% of the cost. So, the payers want patients to be cared for this way. The patients are better being cared for this way. And it does actually allow you to have a long-term relationship because, rather than a hospital like CMC seeing our patients only when they're very sick, actually to have a relationship where we might be speaking to them daily or once a week or when they have a problem, makes you their partner in health for life, and it builds a much stronger, stickier relationship. So, for the individual operator that's running these hospital at home programs, you tend to have relationships that go on for years and are much, much more highly valued. But the people that are picking up the cost, whether it's the government funding for care or private health insurers funding for care, this is a way of actually reducing costs and everybody wins. So I think you're going to see a lot more of this over the coming years.
Interesting. I want to come to that public and private and how those different centres interact in this type of care delivery model. But as you were talking to, I was thinking, in your more traditional bricks and mortar healthcare setting, we generate a lot of stuff, don't we? There's a lot of the physical presence and the all the bits and pieces around. And I guess in this era of how important the notions of sustainability are, and right up through through organisations, I would imagine too that there's positive implications that this kind of more virtual or at home model would have in relation to sustainability as well. Is that all part of the picture?
Yeah, well, as you know, in the Middle East and particularly here in Dubai, it's a very competitive landscape. I mean, there's over 58 private hospitals, more being built, and the typical model is, trying to persuade patients to choose to use you. Every day you don't know how many outpatients you're going to get or how many patients coming in needing surgery are going to be there. You want to have strong clinical departments. You want to have doctors that stand out so that people trust your hospital over other hospitals that they could have gone to. Clearly, where you do have these hospital at home programs, and you might have hundreds, thousands, even tens of thousands of patients that you're monitoring on a day-to-day basis, then the whole system becomes more predictable. You can deliver the medication every 2 or 3 months when the patient needs it. The patient doesn't have to go for a primary care appointment to get the new prescription. It's just automatically released to them. If someone's got a medical condition that you want to run some comprehensive blood tests every quarter or every 6 months, you can send a phlebotomist to the patient's home. You can run those blood tests and you can pass the information back. So I think the future of healthcare isn't just marketing to patients to say we're a good hospital, we've got great doctors, come and see us. It's about how do we hold hands with those patients on an ongoing journey, and then obviously they trust you that when they do have a significant issue, you can bring them in when you need to look after them and fix them. But actually on a day-to-day basis, they know that you're there for them 24 hours a day.
Mm. And, as you mentioned too, it can be a competitive landscape in the private healthcare or hospital setting, and particularly in this region. But no doubt, like any good healthcare, there are patients would see a wide breadth of clinicians, and that journey might see them across different care settings. How have you seen in your experience, in whether in this model or just generally healthcare, those connections between the public and private setting, and maybe how CMC navigates all of that too?
Well, I think things are changing. I mean, historically, the public sector did their thing and the private sector did theirs. You'd fight for patients. There was always a slightly uneasy relationship with insurers, because insurers want you to do a good job in looking after their members, but they want you to be as efficient and as low a cost as you can be in providing that care. I think that where you start to look at population health and how you start managing both the preventative aspects, the monitoring and stabilizing of disease groups, you perhaps bring these systems closer together. In the first instance, if you're doing the hospital at home programs, you're reducing the overall cost to the payers. So as opposed to a semi-adversarial relationship, you start to have a collegiate relationship. And then when it comes to the public sector can say, look, we're not necessarily set up to do things like hospital at home, so can we support you from the private sector and actually have government patients being looked after in a program like this? So I think it's actually forcing better collaboration, better partnerships, and ultimately that ends up being good for patients.
Mm. So true. Hey, Marco, we're in speaking to a seasoned executive such as yourself, who've seen, the tides changing in healthcare, and in an exciting region like the Middle East, you suggest, that there's more and more hospitals and clinics being built, more healthcare to be delivered, and more, which would bring with it, I guess, more CEOs, more executive teams looking to navigate some of these challenges that are faced and serve more patients. If you were to be providing advice to, those executives, the leaders within healthcare that listen to the Healthcare Matters podcast in these changing times, new emerging technologies, increasing patient demands, how do you navigate all of these competing priorities, and what advice would you give to them?
Well, I think, like any organization, you're as good as the team that you pull around you. So, the first thing for any CEO to realize is, you are not the person that has an answer for everything. So, you can dictate the culture of an organization. You can create the right environment for patients, for nurses, and for doctors to all work together as a team. But I think that in an area like the UAE, you've got to stay ahead of the game. So if you've got the basics right and you have the right team, the right doctors, the right departments, the right equipment, then you've got to say, well, okay, how do we outflank our competitors? What are we going to do differently? And that's about going and staying close to your insurers, staying close to your regulators, looking around the world and looking at what's being done in genetics, with stem cells, with advanced robotics, with emerging AI in so many different fields, and just saying, as a leader and a leadership team, how do you spend enough time looking out at where the world is evolving to, rather than looking back and concentrating on traditional practices? Because particularly in the Middle East, which is renowned for innovation, the people that are going to be winning in the future are those that combine great care, great empathy in the way in which patients are looked after, creating a work-life balance for a team internally that enjoy being part of your organization, but also an organization that pushes the boundary in terms of what's coming through next and what's appropriate for you to be looking to innovate.
So true and well said. Hey, you touched on, because we went heavily into AI in this conversation for a while, and these days one can be, forgiven for doing that. But there are many other technologies and innovations shaping how things are done in healthcare and getting a lot of interest. There's stem cell therapy that you suggested, and the robotics side, and genomics, and that gets a lot of attention. Are these the kind of things that are also on your radar at CMC? Is it areas that you're exploring into?
Yes, I mean, we're literally establishing a stem cell lab at the moment. I mean, at the moment, that would largely be, using that for longevity and making patients feel and look better and younger. But genetics is changing the way in which we think about healthcare, and there's going to be more and more personalized medicine, where you start to say, I can be predictive in what I'm likely to face in the future, whether that's going to be cardiac problems, neurological problems, and if you know something's coming, you can adapt your lifestyle. There can be targeted medications that can help you defer, delay, or stop certain things happening. But I think we're just scratching at the surface of where stem cells are going to be used. They can be used, and they have been used to actually regrow cartilages, to help repair severe accidents after road traffic trauma, to repair and improve outcomes for neurological conditions. We don't yet fully understand the true scale and potential of this, but I would warrant that within the next 10 years, there will be a lot of treatment protocols that we aren't doing today, we aren't even aware of today, that become the absolute model for how you treat certain conditions, and it's going to just exponentially grow. And of course, the combination of machine learning and artificial intelligence working with where genetics and stem cells are going just allows you to extrapolate in a way that the human brain probably isn't capable of. So it's a very exciting time to be coming into healthcare.
It sure is, and you made me think, because you're so right in terms of, in a short period of time, there may be new technologies or ways of doing things that we've not even fathomed as yet. That makes me think, on one side, that's exciting. On the other side, as someone who might be, at the helm of a hospital group or a setting, or even anywhere in the healthcare system, it's like, how do you even plan for that? Like, in terms of, and when your role is to be able to look ahead to the future, and and in days gone by, you could have a 10-year plan. You'd kind of know the trajectory in which things are going. It feels like sometimes healthcare is going at a much more rapid rate that we may, in 10 years time, we can't even predict what the future might bring. How do you navigate those, lead a team into the future, and think about what to do, what direction we're going, when sometimes the future can feel a little bit unknown?
Yeah, I think that's a good challenge. I mean, in most healthcare systems, the regulators would say, potentially a doctor, um, nurses, even executives should do a certain amount. It's typically around 50 or 60 hours a year of professional ongoing education, CPD, CME courses. And a lot of that, maybe half of that, is left to the doctor's own reconnaissance. So you can say, I did half of my required ongoing learning by reading or watching educational videos,
or listening to a podcast,
or listening indeed to a podcast. And I think that maybe that isn't enough. I think the pace of change, if you qualified 20, 30 years ago, medicine that is being taught today is barely recognizable to what you were taught. Hopefully over your career you've maintained currency and you're keeping up. But if as that speed of change increases, you can't put your head in the sand. You have to be on that front foot. We're lucky in this region, with events like Arab Health, many conferences across all disciplines, and I think people do have the chance to stay in touch, but it is something that you have to be, as a leadership team, vigilant on, because if you concentrated on the basics and you put your head in the sands a bit for 5 years, when you lift your head, your competitors are going to be moving ahead of you, and this is literally changing week by week in terms of new applicable technologies that actually will make you better, more efficient. You can support your patients better, and you can deliver better clinical outcomes.
Can blink and it's a new world, so it's great to be able to keep up with that to stay ahead with the team. Hey Mark, I think we've covered a lot in terms of this conversation and some good advice and a little bit of insight into how CMC is contributing to that. I guess lastly then, from your side to cap off the conversation, is there what's exciting you most about the future of healthcare in the landscape that we've shaped, or where will you be placing your priority over the next couple of years to really in the end ensure centres are delivering better patient care and perhaps more equitable care as well?
Yeah, I mean, I have the good fortune to be sort of leading a team at one of the most advanced hospitals in the region. What we're doing in robotic surgery and minimally invasive surgery is at the forefront of healthcare today. But again, as I said, we've got to keep an eye on what's coming. You've got state-of-the-art radiology, but you're now able to go into, say, an MRI or a CT scan to overlay it with AI technology that increases capacity by 30%, increases the accuracy of diagnosis by 50%. There are so many things that are happening that are helping to improve what you do, and things that you might not do today, but within the next 2 or 3 years you're going to. I mentioned our hospital at home program. We're really excited to see where that goes. The stem cell lab, I'm sure that will evolve, and we'll be doing a lot more in the kind of cutting edge of how do we use the knowledge about stem cell medicine and genomics to actually help patients in different ways. So it's dynamic, it's fun, and I think it's all good for patients because it ultimately helps them live longer, happier and healthier lives.
Yeah, exactly. Well, Mark, really well put. I really appreciate you making the time for this conversation. Looking forward to that future you've painted. Thank you so much.
Thank you very much indeed.
And thank you for tuning in to the Healthcare Matters podcast. Make sure you're subscribed on Apple Podcasts, YouTube, or Spotify so you can catch all the future episodes. This one is powered by Arab Health in partnership with Clemenceau Medical Center. My name is Peter Birch. I'll see you next time.